This project is titled Tobacco Use Cessation Counseling as a Means of Primary Prevention in High-Risk Ophthalmological Patients. So in terms of our introduction, I feel most of us know that eye disease, blindness, such pathologies, vision, they've all been trending in the proper decisions that we've been wanting to see for the last several decades. And this is in part due to the massive improvements in medical technology, medication, etc., where we have been able to identify, prevent, and treat these presentations significantly better than we were able to do before. Education has also skyrocketed and people are better equipped to understand the consequences of their actions. However, one of the interesting phenomenon is associated with tobacco use. It's well known that tobacco use is associated with a variety of diseases, both related to the eye and not. And these include glaucoma, diabetic nephropathy, cataracts, and countless other eye and non-eye problems. So tobacco use cessation, therefore, is a grade A recommendation by national government policy. So this doesn't necessarily, however, mean that we have perfect compliance in practice. Sometimes we have short visits where we can't get through all of the concerns. Sometimes that's a tricky topic to bring up, as patients may feel as though they're being blamed, and it may be very hard for them to stop due to the highly addictive nature and difficulty associated with quitting. However, we felt as though we could kind of help start tackling this problem a little bit. So in terms of our methodology, we had some pamphlets, one for the patient and then one for the provider. They included very digestible, easy statistics, an actionable plan and resources for tobacco cessation. So we sent these pamphlets to willing providers and we asked them to report back on compliance. So this project took place over 11 months, starting in January of 2020 and then ending in November of 2020 with 10 providers and 100 patients, 10 patients per provider. So the benefit of this that we were hoping was that we could make a situation where we could have an easy handing out of the pamphlet, and the provider would know specifically what they can do in a short period of time. In terms of our results, of the 100 patients, 24% reported already having received the counseling and were not interested, and then 76% had not yet received tobacco cessation counseling and were interested in continuing with the pamphlets. So in terms of our conclusion, this is such a basic thing. Tobacco use cessation is unanimously agreed upon by experts to reduce diseases of all sorts, including inside the eye. So we propose that using pamphlets and these kind of easy materials is critical because it gives the provider a chance, even in a hectic appointment where there might not be a huge amount of time to discuss tobacco use cessation, which can take upwards of half an hour or sometimes even an hour with a skilled provider. A pamphlet is an easy solution where a motivated patient has all of the specific resources, education, and through and through everything that they need to stop quitting and the reasons for doing so in a manner that doesn't take a huge amount of time, so it can be given to every patient. We propose that this is a highly time-effective, non-intimidating means. It doesn't make the patient feel as though they're being judged. It could become very standard practice, and we hope that by using the study and expanding upon it with further studies, we can make this a standard practice and prove that there is a significant difference among tobacco use cessation among these patients who have gotten the pamphlets, as opposed to the standard practice, which is now not necessarily handing them out to every tobacco user. Thank you very much.